Hey, future doctors! We're going to talk about a really important health problem called diabetes. It affects a lot of people. As medical students, you need to know all about it. Why? Because you'll be the ones helping people with diabetes live healthier lives. You'll be explaining things, answering questions, and providing support. Diabetes is tricky. It can cause lots of problems in the body if it's not controlled. But with the right knowledge, we can make a real difference. We can help people manage their diabetes and lower their risk of complications. Are you ready to become diabetes experts? Let's get started. Diabetes happens when your blood sugar, also called glucose, is too high. This condition affects millions of people worldwide and can lead to serious health complications if not managed properly. Glucose is like fuel for your body. Just as a car needs fuel to run, your body needs glucose to function. It comes from the food you eat. When you consume carbohydrates, your body breaks them down into glucose, which then enters your bloodstream. A hormone called insulin helps your cells use glucose for energy. Insulin is produced by the pancreas and acts as a key to allow glucose to enter your cells. Think of insulin as a key. Without it, glucose can't enter your cells and provide the energy they need. It unlocks the doors of your cells so glucose can get in. This process is essential for maintaining healthy blood sugar levels. In diabetes, this process goes wrong. Either your body doesn't produce enough insulin or it can't use the insulin it makes effectively. There are two main types of diabetes, type 1 and type 2. Each type has different causes and requires different management strategies. Type 1 diabetes. In this type, your body doesn't make enough insulin. This usually starts in childhood or young adulthood and requires daily insulin injections. It's like having a broken key. No matter how hard you try, it won't unlock the door to your cells. Type 2 diabetes. This is when your body can't use insulin properly. It often develops in adults and is linked to lifestyle factors like diet and exercise. It's like the key doesn't fit the lock anymore. Your cells become resistant to insulin, making it difficult for glucose to enter. Both types lead to high blood sugar, which can cause serious health problems over time. These include heart disease, kidney damage, and nerve issues. Managing diabetes involves monitoring blood sugar levels, eating a balanced diet, and staying active. Diabetes is a global health problem. Millions of people around the world have it. Sadly, the number of people with diabetes is increasing. Type 1 diabetes is usually diagnosed in children and young adults. Type 2 diabetes is more common in adults. It's linked to things like being overweight, not exercising enough, and having a family history of diabetes. It's important to remember that anyone can get diabetes. Understanding the risk factors can help us identify people who might be at higher risk and work with them to prevent the disease. Let's delve deeper into what goes wrong in the body with diabetes. Diabetes is a complex condition that affects millions of people worldwide, and understanding its root causes is essential for managing and preventing it effectively. Type 1 diabetes is an autoimmune disease. This means that the body's immune system, which normally protects us from harmful invaders like bacteria and viruses, mistakenly targets and destroys the insulin-producing cells in the pancreas. This destruction of insulin-producing cells leads to a lack of insulin, a hormone crucial for regulating blood sugar levels. Without insulin, glucose cannot enter the cells and remains in the bloodstream, causing high blood sugar levels. The exact cause of this autoimmune attack isn't fully understood, but it's believed that a combination of genetic factors and environmental triggers, such as certain viruses, might play a role in initiating the disease. On the other hand, type 2 diabetes develops gradually over time. It is often associated with lifestyle factors such as poor diet, lack of exercise, and obesity, which can lead to a condition known as insulin resistance. Insulin resistance occurs when the body's cells become less responsive to insulin, making it harder for glucose to enter the cells. As a result, the pancreas produces more insulin to compensate. Over time, the pancreas may struggle to keep up with the increased demand for insulin. This can eventually lead to the pancreas becoming exhausted and unable to produce enough insulin, resulting in high blood sugar levels. High blood sugar levels can cause a range of health issues, including damage to the eyes, kidneys, nerves, and heart. Therefore, managing blood sugar levels is crucial for preventing complications. Understanding the different causes of type 1 and type 2 diabetes is crucial for proper diagnosis and treatment. By recognizing the underlying mechanisms, healthcare providers can develop more effective strategies to manage and potentially prevent this chronic condition. Section 5. Spotting the signs of diabetes. Diabetes can be sneaky. Sometimes there are no symptoms at all, especially in the early stages. That's why it's important to be aware of the possible warning signs. Frequent urination, especially at night, excessive thirst, unexplained weight loss, increased hunger, blurry vision, slow healing sores, and numbness or tingling in the hands or feet. If you notice any of these symptoms in your patients, it's important to consider diabetes as a possibility. Section 6. Diagnosing diabetes. Diagnosing diabetes is usually straightforward. We use simple blood tests to measure blood sugar levels. The fasting plasma glucose test measures blood sugar after an overnight fast. The oral glucose tolerance test measures blood sugar after drinking a sugary drink. The A1C test measures your average blood sugar level over the past 2 to 3 months. These tests help us confirm the diagnosis and determine the type of diabetes. Section 7. Taking control of diabetes. Managing diabetes involves keeping blood sugar levels within a healthy range. This is essential for maintaining overall health and preventing both short-term and long-term complications. Regular monitoring of blood sugar levels helps in making informed decisions about diet, exercise, and medication. This can help prevent complications such as heart disease, nerve damage, and vision problems. Regular checkups with healthcare providers are crucial to monitor and manage these risks effectively. Lifestyle changes are crucial for both types of diabetes type 1 and type 2. These changes not only help in managing blood sugar levels but also improve overall well-being. Healthy eating, which means choosing foods low in saturated and trans fats, cholesterol, and added sugars. Incorporating a variety of fruits, vegetables, whole grains, and lean proteins can make a significant difference. Regular exercise, aiming for at least 30 minutes of moderate intensity exercise most days of the week. Activities like walking, cycling, and swimming are excellent choices. Exercise helps in improving insulin sensitivity and overall cardiovascular health. Weight management, where losing even a small amount of weight can make a big difference. Achieving and maintaining a healthy weight can significantly improve blood sugar control and reduce the risk of complications. Medications. People with type 1 diabetes need insulin injections or an insulin pump. It's important to follow the prescribed regimen to maintain stable blood sugar levels. People with type 2 diabetes may need oral medications or insulin. These medications help in managing blood sugar levels effectively and should be taken as directed by a healthcare provider. It's important to work with patients to create a personalized management plan that fits their individual needs and lifestyle. This collaborative approach ensures that the management plan is sustainable and effective in the long term. Section 8. Diabetes complications. What could happen? Over time, high blood sugar can damage blood vessels and nerves. This can lead to a wide range of complications: heart disease, stroke, kidney disease, eye problems, including blindness, nerve damage, and foot problems, including amputations. These complications can be serious, even life-threatening. Emphasizing the importance of good blood sugar control is crucial to help patients avoid these problems. Section 9. Preventing diabetes and looking ahead. While type 1 diabetes can't be prevented, we can often delay or prevent type 2 diabetes. Here's how. Maintain a healthy weight, eat a balanced diet, and get regular physical activity. For those already diagnosed with diabetes, the goal is to manage the condition effectively to prevent complications. With proper management, people with diabetes can live long and healthy lives. Section 10. Your role in the fight against diabetes. As future doctors, you'll play a vital role in the lives of people with diabetes. You'll educate patients about their condition and how to manage it, provide support and encouragement, help them navigate the challenges of living with a chronic illness. Remember, diabetes management is a team effort. By working together with your patients, you can make a real difference in their lives. Now go out there and be the amazing doctors I know you can be.